resolutions. And I just want to say that this was a very enriching conference, and the discussions that were here, at least if I where I was seated, we were asking ourselves, we normally have the Council of Governors meetings. What do they discuss? These are the things they need to hear. Because 90% of us seated here, we may not make those decisions at that level. So I've just tried to put together a few of what we discussed. I know it's not complete, it will be added, and I'll call upon you if there's something you feel that needs to really be added, just put on a paper and pass it to me. Thank you. Now, we have talked all through about nurses need to be on the decision-making table, and it was very clear. Don't wait to be invited. You need to be strategic and assertive enough to be on that table. No one is coming to pick you from where you are quiet to bring you to a table and you are not known. You have to be felt. You have to be heard for you to come on that decision table. So coming from here, how do we organize ourselves? How do we better strategize ourselves so that we are felt and heard at that decision table, at whatever level that you are? The other thing that is very, very clear here is UHC is unachievable without the role of the nurse. And moving forward, after positioning ourselves to be on at that decision table, we also need to come up with our facts on how we want to be involved in this UHC implementation. At the decision table, we also need to talk about what do we need to be empowered with to be better placed at that table. Do we want anything to do with leadership, that training? What is it that we really want to be empowered with to be felt and make a better decision, contribute to better decisions within the table that we need to sit on at whatever level we work and in our different setups. And there's a recommendation that we have the ICPD conference coming up. ECSACON as a chapter. Think through about which commitment you can hold the government accountable for. So we want to be felt at that table. So we hope that the chapter is positioning itself to be felt at that ICPD conference that is coming up. The year 2020, the year of the nurse, it also comes back to us. What action points do we want to have so that we are heard when it is our year? What do we want to do? We need to also think through and come up with an action plan for 2020 as nurses of this country. Moving forward, we are saying that with UHC, we have patients that need to have been dealt with at the community level, coming to our referral centers with more even maybe complicated issues that could have been held at the community or addressed at the community level. So we need to go back and think through about the health-seeking behaviors of our people so that when we draft implementation strategies and come up with implementation strategies, we are aware of how these people seek their health care services. Another key recommendation was scaling up of training on emergency obstetric and neonatal training care for nurses. There is a need for that. The few that have been trained have made an impact where they are. So there's a need to scale up this training. There is need also, another recommendation, there is need to have experts at the community level. It came out clearly that the community structure in this country is not really working right. So how do we go back and think about having experts at the community level? Because if you deal with the complications that bring complications at the community level, then the referral chain is much easier with fewer clients or other patients. On the discussion about healthcare financing came up with a recommendation in terms of we have a big number of informal sector. It's reached a point where we need to have this formalized, this sector formalized in terms of their contributions to the national health insurance schemes. At the long run, you find that this scheme supports very many patients or very many clients, but then the contributing people, most of them are the ones that are in formal employment. Yet the guys in the informal sector may be even having more income than those in formal employment. We also need to have continue building on our data to justify and have rationales in terms of our workforce needs. You cannot go and talk about it if you don't have justifiable data to argue about with. So that is that's another recommendation that came up from this meeting. Then there was also an indication that we also need to look around small incentives within our work setups that go a long, long way in motivating nurses to feel appreciated and even work harder at whatever level that they are. So wherever we work, do we have small incentives or small strategies that can go a long way in nurses feeling appreciated? For example, even a thank you for the work that you did can make a big difference. Yeah. So can we look at that? Some of them may not be very costly. A small certificate of recognition can go a long way in someone feeling appreciated. The presentation on the legal framework, what came out on the legal framework in health service delivery, what came out clear, nurses were, the participants were feeling that it's more of what the client, it's more of protecting the client and not necessarily protecting the healthcare provider. So there is need to follow up legal issues where nurses' rights are violated or infringed at the workplace. We've had cases of nurses being slapped, and MCA came and slapped. So how do we go about that? We had the legal presenter talking about cases of specific clients that have been followed up. Could we maybe pick up one case of a nurse and also follow it up? They talked of having pro bono lawyers. That is something that we can explore and follow up. And last but not least, re-evaluation of the training at KMTC, as the graduates seem not really prepared for the market. Is it only in KMTC or in other colleges? But we are very, very keen on these ones who are coming to join the profession. If they are not prepared for the market, what is the missing link between the instructor and the student? That needs to be thought through. Then lastly is unions and professional bodies cannot be left behind during decisions related to employment and deployment of healthcare workers. As we move forward towards whether it's contractual employment or permanent and pensionable employment, we need to look at that in terms of involving and engaging the professional and the union bodies. I hope I've tried to capture much of the recommendations, but I'm still waiting for more, if there is any left. Thank you.
Thank you, Faith. 1, 2, 3.